these mosquitoes, and they called them tiger mosquitoes. And if you looked at them, they literally had like stripes on them. They were aggressive. And Winnipeg, because of where it is, the mosquito problem. Oh my gosh! Like for about a month in the summer is brutal. I mean, you run to your car.
I remember some of that in last.
Yeah, same kind of thing, right? Yeah, big, aggressive, not very happy.
We're lucky around here.
Turn them off.
I know if you're turning them off.
Think I'll live with you?
When I had a great conversation, I saw it. But I wanted to.
A whole different.
If you were high leader, that's not my loss.
Good morning. Good morning, Roy. Good morning. Thank you. I have my own board meeting tonight at 6, so a busy day. I didn't get home until 7:30 last night, because you have to do all that prep work.
Oh, yes.
But, well, you know that.
I do.
Yep. Do this. Glass. Good morning, Susan.
Jack, how are you? I just got them some coffee from Washington.
Oh,
Little taste, because I'm telling you, like 30 pounds.
yeah, that's what
I
you
mean, I
said.
can't believe that.
I would have been off the wall, but I drink decaf. I don't drink regular
Yeah.
anymore. Makes my heart race.
So I would like.
Yeah.
I forgot my drink. Get it.
So far, I'm sure they'll be coming in. Yeah. Good morning. Yes. We were just wondering if we're going to even have a quorum today.
Oh,
I'm sure we will. People just drag in.
yeah. I've got to use the restroom.
Okay.
I'll be right back.
Okay. Good morning.
How are you?
I'm good. How about you, Michelle? Good. Morning, Dave. So you were the only one that voted. Have they thought about, like forces and like sheriff's department and valley?
First part was happy with what they had. I mean, that's what I'm looking at. So, I don't think. Perhaps go to jail. In Colorado. So, I really, set of questions.
Good morning.
Yeah, it's yeah, it's just
Well, good morning, everyone. We're going to start this meeting of the Board of Health. It's good to be back with everyone after a month off. It seems like we haven't been here for a long time, but in the busyness of the summer, it's a kind of a welcome break for many who want to go on vacations and things of that nature. But welcome. We're glad to have everyone here. We're going to start off with a roll call. We'll start off with our Vice President, Doris Ralston.
here.
And Commissioner Lojinas Gonzalez is joining us on Teams. You're out there? Great. Councilmember Dave Donaldson?
Here.
Dr. Richard Vu?
Here.
General Jack Briggs?
Here.
And Mayor Glant Havenar?
Here.
Great, and we understand that Commissioner Cammie Bremer is absent and out of town this morning, so she will not be joining us. Is everybody able to hear me? I'm sorry, the microphone's not broadcasting, but I'll try to speak loudly enough for everyone. We need a motion to approve the agenda, if you've all had a chance to see it.
So moved.
Okay, thank you, Doris. Thank you. Mayor Havenar, and all in favor of approving the minutes?
Aye.
It's the agenda, correct?
The agenda,
The agenda,
yes.
thank you.
Aye.
Aye.
And any opposed? Okay, so we're going to open it up for some Board of Health comments. I'll look around the room. Anyone have anything to bring forward publicly? General?
Director Whelan and I are on a public safety initiative that is being done by Colorado Springs, and I just wanted to compliment Director Whelan's engagement with particularly data for the city coming from the county. I think that at times people get they get focused on what I would consider to be anecdotal information, and when public health and other authorities can bring data to the table, I think it helps to focus the conversation. So I just wanted to acknowledge that and appreciate that. So thank you.
Any others? Public comment? Okay, I will bring forward or just mention that the end of last month, beginning of this month, kind of just a few days there, Director Whelan, myself, Carolyn Gray, and Harry Sigmund, along with Dr. Vu, got to go to Tacoma, Washington to the NALBA National Conference, which stands for the National Association of Local Boards of Health. We had a great time at the conference. We were able to present. Director Whelan put in a presentation request for us, and we were able to present to other boards of health members from around the country, as well as health officers, to talk about what it means to support your workforce, and in supporting your workforce, how that in turn helps to support your community. And it was very well received. We got a lot of very positive comments, but the being a part of the conference and being there with people from all around the country, sharing ideas, hearing what other people are doing, did a couple of things. Number one, it's inspiring to be around people that have a like mindset. The other thing that it did was it was very confirming. You've heard us say from this position before that we have a very, in comparison around the country on national averages, we have a comparatively small staff. But when you see the kind of work that that small staff is doing in comparison to some of the things being done around the country, it was very confirming that we're doing really great work for the community. When I say we, I mean really our public health staff is doing terrific work for our community. Regardless of the size of the staff, they're very high producers, and that became very apparent as we listened to other presentations. Anything that you'd like to add, Dr. Vu or Susan? Go ahead.
So it was a wonderful time we had in Tacoma. I get to know some of my co-workers or colleagues better, and dancing goats was a good experience. There was the conference was, of course, wonderful. There were two things that kind of stuck out in my mind. One is I don't know why I didn't know this before, but I learned the difference between equity and equality. So I don't know why I didn't know that before, but that's important in my mind. And the other thing that I heard that stuck was been thinking about it a lot. Was someone said when you come to a fork in the road, take it. And I don't know why I've been thinking about that a lot, and I don't know if I truly agree with that. I really think when you come to a fork in the road, you make sure that you take your time, evaluate your risks and benefits and your options, and make the right decision rather than just take one or the other. So thank you.
Okay.
I'll say a few words, and I'm not sure. My mic is on, but I'm not sure if it's working. So I would just like to echo your comments and also acknowledge, with Carolyn Gary, our development officer, as well as our new workforce development director, Carrie Sigmund. It was a great opportunity to be on a national stage to talk about the good work here in El Paso County. And with that also, our president, Ted, was acknowledged numerous times in different keynotes throughout the conference, because as part of the presentation, Dr. Gary, President Ted, and I had presented, and they were taking pieces of our presentation and weaving them into keynote and talking about the importance of how do you frame prevention and how critical it is. And he had some analogies around being a former fire chief, that the majority of time that the for the fire department, they're working on prevention and they have to be ready. And he talked a lot about that and emphasized that. And he resonated with a lot of the Board of Health members, as well as numerous different agencies, with local public health and state public health. And they also asked us to be ready for next year to present. So I thought it was a good use of time, and it's always nice to get to know board members better as well.
Can I just say that Chief Colas was known as the firefighter from Colorado?
Well, thank you. That brings us to the approval of minutes. We need someone to make a motion to approve the minutes.
I make a motion to approve.
Thank you, General Briggs, and we need a second.
Second.
Okay.
Dave
Thank
Donaldson.
you, Commissioner Donaldson. All in favor of approving the minutes as written, let me know
Aye.
by saying aye.
Aye.
Aye. Any opposed? Okay. Now we're moving on to public comment for items not scheduled on the agenda. We'll start off with people in the room. Do we have any public comment? Seeing none. I do know that we have one person online who has requested to make public comments, so we'll see if we can get them in now. Okay, you're on. Go ahead.
Hello, good morning. My name is Danielle Everett, and recently, with recent news, it came to my attention that there had been some issues out of Wrigley, California, Fresno, with an illegal lab that was connected to China. And there they had over a dozen infectious diseases, over 1,000 bioengineered mice that were infected with. As I mentioned, they had this connection to China. And one of their conferences is addressing it there in California. However, it's not only a public health issue, but something where the city of Fresno, Fresno to address policy to legal labs such as those in their county, and to take a closer look at for a national what could be. So I wanted to bring that to of our public health board, request that something that you guys look into, eventually meet with our city council and our county board of commissioners to see what policy especially considering strong military presence.
Thank you, Danielle. I appreciate that, those comments, that information, and we can definitely look into that.
I appreciate that. Thank you.
You're welcome. Okay, and that takes us to our finance and budget presentation.
Mr. Chair?
I'm sorry? Oh, Commissioner Gonzalez, go ahead. I'm sorry.
Yeah, just in response to that, something that staff says, oh, look into. Do we have a list of things like this? Is this something that other areas have seen? I'm just wondering, are there kind of labs that are formally utilized in our camp that could be concerned with? And if we don't know, that's fine. I did one of the articles. I saw one, because that's Nickelodeon, by English. But I just want to see, want to make sure that it's not awesome. Stuff like that. Thanks.
Go ahead.
Commissioner Gonzalez, we don't regulate laboratories, and we don't have an inventory, but it's something that we can look into with the appropriate authorities and coordination.
Okay. Fine. Thank you.
Okay. Budget presentation. Any board questions? Nope, seeing none. Thank you. That moves us into new business. I know our county attorney, Lori, is with us, and Lori is going to read a couple of proclamations. We will need a motion and a vote on each of the proclamations as they're we do that after you read them, so everybody has a chance to hear what these proclamations are. And Lori, would you tell us first just what they are, the two proclamations? I've got them sitting here.
Sure. We have two today. The first is a proclamation of the El Paso County Board of Health recognizing September 2023 as National Preparedness Month. And the second is proclamation of the El Paso County Board of Health recognizing National Suicide Prevention Awareness Month 2023.
All right.
So we'll start with the first. Proclamation of the El Paso County Board of Health recognizing September 2023 as National Preparedness Month. Whereas preparedness within the field of emergency management can best be defined as a state of readiness to respond to a disaster, crisis, or any other type of emergency situation, according to the Federal Emergency Management Agency. And whereas disasters and emergencies often have public health consequences that impact the local jurisdiction. And whereas preparedness is a continuous cycle of planning, organizing, training, equipping, exercising, evaluating, and taking corrective action in an effort to assure effective coordination during incident response. And whereas El Paso County Public Health, EPCPH, will prepare for, respond to, and recover from all hazardous incidents or events which pose an imminent or potential threat to the health, medical, and environmental needs of El Paso County residents. And whereas National Preparedness Month is observed across the nation every September to raise awareness about the importance of preparing for disasters and emergencies. And whereas the Ready campaign's 2023 National Preparedness Month messaging will focus on preparing older adults for disaster, specifically older adults from communities that are disproportionately impacted by all hazard events, which continue to threaten the nation. And whereas EPCPH participates in National Preparedness Month by encouraging the community to take actions to prepare themselves and their families, children, and pets for emergencies or disasters, such as building emergency kits, making a plan to communicate with loved ones, and developing evacuation plans and meetup points with family. And whereas the EPCPH Emergency Preparedness and Response Program also encourages agency and county staff to engage in and prioritize personal preparedness. And whereas EPCPH maintains a ready workforce and requires all staff to take incident command system trainings to prepare, serve, and first responder roles they may have in public health or other emergencies. And whereas EPCPH has taken a lead role in responding to various public health emergencies in the past several years, such as the hepatitis A outbreak in 2018 to 2020, the 2019 to 2022 COVID-19 pandemic, and the 2022 monkeypox outbreak. And whereas EPCPH has also provided critical support during other recent disasters and emergencies, such as the 2012 Waldo Canyon fire, the 2013 Black Forest fire, the 2013 Manitou Springs flooding, the 2015 Planned Parenthood mass shooting, the 2018 Fort Carson Midway fire, the 2019 Regency Tower fire, and the 2022 Club Q mass shooting. And whereas EPCPH recognizes the need for and importance of encouraging the community to take action and prepare for disasters and emergencies that could happen at any time. Now, therefore, be it resolved by the El Paso County Board of Health that the month of September 23 is proclaimed as National Preparedness Month in El Paso County, Colorado. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting held on August 23, 2023 in Colorado Springs, Colorado.
Okay, thank you, Lori. Can I get a motion to accept this proclamation?
So moved. Councilman Donaldson.
Okay, Commissioner Councilmember Donaldson, and then Mayor Havenier for the second. All in favor? Well, let's have some discussion first. Anyone want to comment? General Briggs?
This is General Briggs for the record. And having had experience as a leader in disaster response for the nation, first of all, I want to make mention of the disaster and the horrific loss of life in Maui over the wildfires, and it gives us pause, and we should be thinking, what do we do here in an area that also is vulnerable to wildland fires? What can we do to continue to refine the processes that we have, the response capabilities that we have? And I would say two things that come out of what happened in Maui. One is leadership, and the second is communication. And what can we do in those areas to improve communications capability, and then leadership accountability. Those are both things that I think are critical when we talk about an incident like that.
Thank you. Other comments? I know that in the audience we have quite a few members of the Pikes Peak Regional Office of Emergency Management. Our new director is here with us, Andrew Nothbaum. Would you all stand up, please? Go ahead.
I'd like you actually to come to the front, please. And then also with our emergency preparedness program manager, Janelle McNair, and then we also have some additional team members, JB, and I see some others. and the audience. I want to emphasize that when there are emergencies, you know, there are always opportunities, you know, when there isn't an emergency or when there is an emergency, to learn lessons and then to continually and improve. And so it's definitely a team effort. It's more than what stands before us today, related with the Pikes Peak office of the regional office and our staff, because throughout our agency, after 9/11, public health was brought in as first responders, and we were required to train under the National Incident Management System. And the reason why we're able to more first responders, whether it's law enforcement, fire department, and others, is because we have made an intentional effort to communicate using terminology that we can both understand, and different procedures and authorities. And so I think that, you know, I depend on this group heavily, whether it's something that is small scale that expands some of our bandwidth here at Public Health, and we oftentimes will limit programs or scale back programs or shut down programs to scale up and address whatever the emergency is. And so it's key to be nimble in that. And with Andrew being here, I just want to congratulate him on his you know, new role, and maybe you want to say a few words because it's relatively new, and then maybe let us know too if you've all hired a deputy yet, because we work very closely together, and that would probably be some good information. So.
You know, first off, I'd like to say hello to President Colas, who I know as Chief Colas in my past life. So nice to see you in this role. Yeah, that's right, exactly. You know, the one thing I'll just mention is emergency management is a system, right? We're the regional office, but it includes public health, it includes mass care, it includes transportation, public works, law enforcement, fire. And so it's so key for us to have partners with ESF 8, which is our public health group. So all the incidents you just mentioned, we couldn't have done that without public health. And we do have a new deputy director. This news is officially unofficial, but we're asking Toby Blanchard, who some of you may be familiar with, is our new deputy within PPR OEM. That fills one of our 2 spots, and she will start on the 31st of this month. So I'm excited to be here. A little bit about my background. I worked with the Colorado Springs Fire Department, spent 10 years here in Colorado Springs, moved to Boulder, was there for a number of disasters, including 2013 flood, was EOC manager in the Marshall Fire, moved back here about 18 months ago, and am new in this position about 3 months. So very excited here. Partnership is a key thing for me. Building capabilities in response are huge, and really looking towards the future of how we can best prepare our community. So,
And Andrew, when you were with the CSFD, did you work with Christina Randall?
That's correct. Yep.
In the mitigation program that we have in Colorado Springs.
That's absolutely correct. And my emergency management journey actually started post-Waldo, doing the damage assessments with Christina and Fire Marshal Lacey. And so that's where I got the bug of emergency management. I followed a girlfriend up to Boulder for about 10 years, and then now I'm back. But love being back here and my time with Colorado Springs Fire Department, and enjoying my time here as the regional director.
And I did want to say thank you also for giving us space at your office, because we just have a one of our public health employees there with emergency response, because coordination and that communication is so key. And I did want to acknowledge some individuals that have played very roles in leadership. Our deputy director, Deanne Ryberg, is, you know, when there's an incident commander, I mean, oftentimes she will serve in that role. And then, you know, public health information officer will serve as the chief information officer that is integrating and coordinating with all different, you know, PIOs in the community. And so those are areas that, you know, you train, we learn, but a lot of time is invested there. And so I think that the teamwork is critically important. But I did want to mention and just give some accolades also to our staff and our emergency preparedness, because we are designated as a Project Public Health Ready, which is a kind of an accreditation for our emergency preparedness efforts. And we are currently the only nationally recognized emergency preparedness and response program in Colorado. And as you all remember too, we we're the first accredited health department in the state of Colorado, and we are the second in the state of Colorado. And so we do a lot with what we're given, and we have phenomenal employees and team members. And so I did want to note that on the national level, our program was also noted for our innovation and our approach to building out a public health data analytics office, in addition to acknowledging best practices for partnerships and stakeholder collaboration during COVID-19 the pandemic. So I think that there's a lot that our employees are so passionate and dedicated, and I think it's so important for emergency preparedness, scaling up or scaling down or whatever that is. And currently, I mean, we're in the process of resetting, refreshing, rebooting through the last few years, and that takes as well. And we're making progress, but we still steady on that front. Don't go through the last few years, not have some areas that we need health and burnout and all of those different. I just want to extend my great appreciation as well.
Okay, and before you all move, I get to say something too. Thank you for the work that you do. I spent a career in public safety and got to work hand in hand with people in OEM. And I'm old enough to remember when there was no OEM. And we all just did everything by the seat of our pants. Emergency happened and we picked up the phone and tried to establish relationships on the fly. That didn't work well. And there's a reason why you do what you do. And establishing those relationships ahead of time and doing what the title of this proclamation tells us, and that is preparedness. Preparing our community for when things happen. And we can't predict. We don't know what that next thing will be, but having the right procedures in place, as Susan mentioned, sharing terminology, as she mentioned, having common communication, and being able to have relationships where we're not picking up the phone on the fly, but we know what to expect from our partners is critically important to a community responding to an emergency, but then even more important in recovery from that emergency is having those relationships in place. What happened in Maui is heartbreaking, and I can't imagine what their OEM staff is burdened with right now. But they have a really critical task of moving forward and getting that community back on its feet and back moving in a positive direction. And it won't happen without the work of people like you in the positions that you hold, making sure that that community is going in the right direction, bringing people together. And there are people reaching out from really a global perspective right now in the state of Hawaii, and that would not happen without an OEM staff that was proactive and working together with all of the partners. So I appreciate you. Thank you for the work that you do, up the good work. And the best thing that we can expect from an OEM staff is to never, ever put you to work in an hope that that never happens. We hope that your work is for nothing, but we know better than that. Thank you. Everybody come forward. I think we're going to take a group photo.
We need to vote on it.
Oh, man, I'm so glad the Doris is here. First of all, for our board, let's vote on it, but don't go anywhere because we are going to take a group photo. I need a motion to accept the proclamation as written. Did we?
We just
Okay,
never did.
So we're ready for just the vote then? All in favor of accepting the proclamation, let it be known by saying aye.
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 Any opposed? None. All right, now we can come forward for
Emergency preparedness involves, all of our employees, so Brittany and Daisha and Emily, Rachel, Vicky, Dr. Albanese. Yeah, everyone. Everyone who works in emergency, it's not just.
Yeah.
Deanne?
Come on, JB. My son didn't want to do that.
not taking a picture. Don't worry about it.
Hey. Thank you, everyone. Lori, I think we're ready for the second proclamation.
All right, moving on. Oh, it's working. Moving on to item 7B, proclamation of the El Paso County Board of Health recognizing National Suicide Prevention Awareness Month 2023. Whereas there were 1,287 deaths by suicide in Colorado during 2022, and whereas 189 El Paso County residents died by suicide and thousands of their friends and family were forever changed by these losses last year. And whereas in El Paso County in 2022, suicide was the 8th leading cause of death for people of all ages. Suicide deaths were 3 times higher among males compared to females, and 4 suicide deaths occurred in adolescents 11 to 17 years of age. And whereas, although El Paso County has seen a decrease in youth suicides the past 2 years, it remains vitally important to continue suicide prevention efforts with partners throughout the county to empower and support youth mental health. And whereas youth mental health and suicide prevention has long been a top priority of El Paso County Public Health, or EPCPH, who convenes the Youth Suicide Prevention Work Group, a collaborative of community partners taking collective action in support of youth mental health and suicide prevention. And whereas the local community and the Youth Suicide Prevention Work Group are also deeply invested in layered suicide prevention efforts, including the Suicide Prevention Collaborative of El Paso County, an alliance of organizations and community leaders with a collective goal to reduce suicide deaths in El Paso County by 20% by the year 2024 among all age groups. And whereas September is National Suicide Prevention Awareness Month, a time when mental health advocates, prevention organizations, survivors, allies, and community members unite to promote suicide prevention awareness. And whereas EPCPH recognizes suicide is a complex community challenge, and each life lost impacts many families, community members, and those who diligently work in suicide prevention. Together, we are changing the conversation about suicide by replacing myths and stigma with information and action steps everyone can take. EPCPH urges all El Paso County residents to take action and prevent suicide in our communities by reaching out to someone who has had a relationship end, has had financial challenges, or is navigating grief and loss, learning about the risk factors and warning signs, asking about suicide directly, and staying connected to those you care about. Now, therefore, be it resolved by the El Paso County Board of Health, number 1, the month of September 2023 is proclaimed as El Paso County Suicide Prevention Awareness Month in El Paso County, Colorado. Number 2, El Paso County Board of Health recognizes that no single suicide prevention effort will be sufficient. Through the combined action of El Paso County residents and community suicide prevention initiatives, we can all work together to increase awareness, take action, and prevent suicide. Moved, seconded, and adopted by the El Paso County Board of Health at its meeting held on August 23rd, 2023 in Colorado Springs, Colorado.
Okay, we need a motion to accept this proclamation as read. Okay, thank you, Mayor Havinyar. And a second?
General Briggs, I second.
Thank you. Any comments? Okay, I think we have some folks in the audience that Susan wants to recognize.
Yes, if Brittany Rifle would come up, and then we also have some partners get our work done through collaborations, and we have a couple of representatives here with us on those collaborations. And if you would like to say a few words, others?
Yeah, awesome. Good morning. I know you all have heard from me a lot in the last couple of months, so I brought some friends with me. But really just want to say thank you. Suicide prevention is such a important role in my job, but also personally. And so this is really a great honor to be well today. So we have Eric Gibbs from PQ Behavioral Health, who's going to say a few words to start us off.
Hi, thank you all for having me this morning. My name is Eric Gibbs. I'm the Director of Business Development for PQ Behavioral Health. I'm also on the board of Pikes Peak Suicide Prevention. I've worked in behavioral health care for the last 13 years in El Paso County. I feel fortunate to have this platform today to make a few remarks regarding Youth Suicide Prevention Work Group and the longstanding partnership with public health. I have been a part of YSP since its inception several years ago at a time when our community was struggling with the aftermath of multiple youth deaths by suicide, which occurred in clusters. Over the years, I've seen YSP grow and progress in a manner that demonstrates efficient and effective collaboration, and those involved are working towards a singular goal of reducing and preventing youth suicide. That level of partnership and cooperation among such a diverse group of stakeholders makes YSP an exceptional asset to public health and the entirety of El Paso County. From my viewpoint as a behavioral health provider, I've personally seen the collective action of YSP contribute to increased access to care for youth across the county. Efforts in promoting prevention over postvention have reduced the stigma of behavioral health care through targeted campaigns, educational trainings, community events, general awareness, and so much more. Care coordination and communication among agencies is continuously improving, allowing for more positive client outcomes as they transition to various care providers and through multiple agencies. At PQ, our mission is simple. It's improve the lives we touch. Thanks to the efforts of public health and YSP, more individuals are seeking care than ever before, and they're seeking that care sooner. Not only is this improving lives, but it is ultimately saving lives. Thank you for your continued support in addressing the complex issues of youth suicide prevention. As the struggles that face our youth evolve, we must continue to rise to meet the occasion. And I think with the YSP Collaborative and Work Group, we can do just that. Thank you for having me.
Thank you, Eric. He's been, involved since I think like 2016 when this group began. And then our next person I invited is David Galvan. He is integrated into faith communities and really helping to support and promote mental wellness in our faith communities. So, and he's both of these gentlemen also serve on our steering committee for youth suicide prevention.
Awesome. Thank you so much for your time. Because I'm in the faith community, you're going to get like a long closing and sermon after sermon after sermon. So don't worry about that. Henry David Thoreau said this statement. He said, "The great masses of men and women live quiet lives of desperation." And all we want to do this month is move from quiet desperation to honest conversation about suicide prevention. That's it. As we do this process, I've been a part of YSP and in this program since the inception almost. In 2016 is what actually created a catalyst in my life to change the direction of what I was doing. We saw students die by suicide at a significant rate. We had double digits that year. Because of YSP, we saw suicide rates go down in 2017, 2018, and 2019. Then we had COVID and the ramifications of that. And we had double-digit students dying by suicide. And then we heard a lot of mental health being talked about, suicide prevention being talked about, and we saw suicide rates go back down for our students in 2021 and 2022. Our goal today, as we endorse this proclamation, is that we continue to see those rates go down. And when we see those rates go down, it doesn't mean that we stop the work. It doesn't mean we stop prevention. It means that we keep doing it. I often ask this question at many trainings that I do, is would you imagine with me a world without CPR? Imagine what that would look like. And often people said we'd have more dead people. I said, then why are we not getting trained in youth mental health first aid? Why are we not doing this process? Why are we not increasing more people to get the resources? I think things like YSP speak to what Mr. Collins said earlier, that the public health model that we have here, we have a limited amount of team members that are actually paid staff, but because we work with community members, because we work with the community, we're able to reduce this in our community. And my hope is that we would have a city where no one's alone and no one loses hope. We aren't known because we have the most suicides in Colorado. We aren't featured in Time Magazine or Newsweek because we lost this many students. I hope that one day as we do this, and I work with a lot of faith communities because that's a large majority of who we have here in our community talking about this on a regular basis, which leaves me with this story. There's a great story that within my faith context about an individual who I call the first recorded suicide intervention. It's a young person who is a jailer, and in that day, he had two individuals he was supposed to watch. As he was watching them, there was an earthquake. That earthquake happened, and he woke up and realized that maybe everybody left. Now I'm going to lose my job. We find this in our Acts 16, and he says he drew his sword and was about to kill himself. A guy by the name Paul shouted, "Don't kill yourself, we're all here." I hope this proclamation offers hope to the people in our community that we're all here. Thank you so much for your time.
Thank you, Eric, and thank you, David, also. I mean, it's, heavy work. And of course, thank you, Brittany, as well. And we were put on the map, Colorado Springs, in 2014 in Times Magazine and with Palo Alto, California, and Fairfax, Virginia. And that wasn't a designation that we wanted to hold as a city and as a county. So we're incredibly grateful for your dedication, and then also promoting mental health first aid, and how to talk about suicide and how to reach out for help. Because one of our initiatives back then when we started out was to increase help-seeking behavior and to stigmatize the need to reach out for mental health services. It is a strength, and to model the way in reaching out. And so I think that momentum is going very well, and we do need to maintain that and not let up. We also extend our thanks to the entire collaboration, because I know that with the Child Fatality Review Team and the coroner's office, Dr. Kelly and Dr. Emily as well, they're very involved in this. And I also wanted to note, with suicide prevention, thanking the El Paso County Commissioners, because back in 2014, 2015, we were talking about funding around, because we didn't have a teen suicide prevention program, and we didn't have any suicide prevention programs for the agency. And I had reached out to then Henry Yankowski, I think his name was, as administrator, and worked with Commissioner Gonzalez and Commissioner Bremer, and just from year to year, trying to get some sustainable funding, and through critical needs funding with the county, we were able to fund some FTEs. And just one FTE or two FTEs can mobilize collaborations that have far-reaching impacts to multidisciplinary and different sectors. So I think the work that you all have been doing has been incredible, and we definitely have more work to do, but to acknowledge that there are so many people and youth and families that have been helped, that know to reach out for help. General Jack Briggs also is the executive director of Springs Rescue Mission, and as a representative of public health, the mayor's office reached out to us to participate on a Colorado Springs mental health initiative, and that is coming together with Mayor Mobilati's wife, Abby Mobilati. And so we're in the process of meeting and defining, what are the areas that we will be working on together. So I see more strength and more momentum to be had, increasing and enhancing the efforts that are already going on to serve the public. And so thank you, thank you, thank you. I know how it is when you get a text or a call and you're thinking that please don't let it be, this call. And it is really nice to see some data that we are making a lot of progress.
Any other board comments?
Can I have a quick question? I also want to thank you for your work, but I think I might have an idea, but can you re-emphasize what some of the myths and stigma are regarding suicide?
Okay. A couple of them. Number one is that if we talk about it, they'll do it. I actually had a individual come to one of my trainings. She emails me back and says, "Hey, I was in a conversation with a friend of mine. She's mid-60s woman, and she was at coffee, and she said, I told her that I went to your suicide prevention training. My friend stopped me and said, I've been thinking about suicide and how it won't impact my life insurance." And so the first myth is that if we talk about it, they'll do it. And that's the biggest one that we want people to know. Number two is that simply asking will cause them to think about it. So just asking the question. The reality is if you ask someone, are you thinking about killing yourself? More often than not, they're stopped in their tracks. And we ask that you ask it twice because most people put off the first question. Have you ever walked by somebody and they said, how are you? And your first response is,
Great.
Fine, great. Too blessed to be stressed, whatever you say, okay? At the end of the day, we already have these pre-made notions that we just say something, so we ask it twice. So that's a couple of those myths that I would identify. Anything else that you would add, Eric?
I think it's just a manner of looking for changes in people's behavior, right? Understanding our loved ones, checking in with them continuously. You know, when one of our neighbors has an illness, right? What do? We bring them a pie. When somebody's struggling with mental health, we kind of close them out. And so I think as a community, one thing we can do is just create more connection. Connection is one of those things that has been proven to reduce suicide across all age groups. And so just having a trusted person that they can confide in, as David said, being able to ask that question and answer it honestly makes all the difference.
Thank you.
Any other comments from the board? I want to thank you for the work that you do. And the families that you impact are families we don't know their names, don't know anything about them because their name hasn't risen to that public awareness because they didn't suffer a loss, because you made a difference. And we're very grateful for that work. Thank you. Keep it up. We need to call for vote for this proclamation. All in favor of accepting the proclamation, let it be known by saying aye.
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 Any opposed? Okay. Photo? Okay.
Yes.
Right, and on our agenda, that takes us down to the director's report.
We're making good time. I was going to mention also the National Association of Local Boards of Health meeting in Washington, and we've already covered that, so I will move on to a couple of other items. I'd like to introduce new members of our public health executive team. If Daisha Hutchin could come up, please, and then also Emily Maney, and I think that's who I see in the audience, but we heavily promote internally, and that's what I like to see as well as far as just retention. And Emily used to oversee our maternal child health area, and Daisha used to oversee, in fact, I think I hired her for the tobacco education prevention partnership, and they have newly been promoted. Emily is our strategic initiatives officer, and Daisha is newly promoted to our community health prevention division director. And so if you could just introduce yourselves, please, that would be helpful.
Good morning, Daisha Hudson, Community Health Promotion Division Director. I've been with the agency almost 11 years, and most of that time was in the tobacco prevention program within community health promotion. I'm just really grateful for the opportunity to continue to serve our community, our agency, and our division, and continue to work with my colleagues. So thank you, and I look forward to working more with you as well.
My name is Emily Maney. I was the maternal child health program manager for 4 years before moving into the position of strategic initiatives officer. My background is in social work, and so I'm really passionate about public health and about our community. forward to more opportunities to serve.
And our strategic initiatives also involves our community health assessment as well as our community health improvement plan. And we did I think a half-day session with Board of Health members on that. And those are really part of our guiding plans. And Emily oversees that. And I don't know if we have our public health planner, Ruba, in the audience. Hi, Ruba, if you want to come up. She also is part of putting those assessments together in the community health improvement plan, and where we work with 60 different organizations, multidisciplinary, and Dr. Albanese, of course, is highly involved in that related to data translation. So there are some significant projects that are going on for public health, and at some point we'll also provide an update around the status of that, and then also the indicators and what we talk about here at Board of Health, and mental health and suicide and substance use and fentanyl. All of these aspects are going to be covered in the community health assessment. So we'll tie that together at some point. But welcome, and I just wanted to put faces to names and for our board members.
Thank you.
And so I have a few more agenda items. I did want to take a minute to thank our administration staff, Vicki Bennett, Rachel Lyons, Kara in the audience, if you want to stand up, and also our operations, because a lot of times we receive a lot of support to put these Board of Health meetings on, whether it's, you see the slides, the content, all of the audio visual, and that there's a lot that goes into that, and a lot of logistics, and just wanted to acknowledge that we appreciate your efforts, because you make it look very smooth for our Board of Health, but there's a lot of details that go into that, and I wanted to take the time to acknowledge you and also thank you, and of course the Office of Communication. Can't forget Pamela and Michelle as well, but in the spirit of talking about staff retention and recruitment and the NALBO conversation and just introducing new promotions, I think it's appropriate to acknowledge existing efforts, and that we value all of the work that you do. I mean, we're a strong team, and we couldn't do it without you. So thank you. All right. So for the next topic that I did want to mention to our Board of Health is that we are currently in the process of auditing our environmental health fees. We have not had any proposed increases to fees coming before the Board of Health since 2016. And those fees involve looking at childcare licenses, on-site wastewater treatment systems, we call that OWT. Yes, body art, and wanted to put that on your radar, that in the future we will ask for the support of holding a public hearing to hear the proposal of what goes into those fees and what the proposed increases will be. And that's a process where you all approve a public hearing, and then we have a public hearing, and then you all vote on it at that time. And Lori, if I got that process wrong, please correct me. Okay. And the third topic we've already mentioned a bit, but I did want to say that with Yemi Mombolati being newly elected as mayor, he has reached out to our agency and asked if I would serve on the public safety solutions team with General Briggs as the CEO of Springs Rescue. And there's a few others that are on there that represent, various different sectors and leaders and also community members within that. And so that, I think we've had 3 or 4 meetings, and then we're having a meeting late afternoon today. But I am encouraged that we're having conversations and we are collaborating, and I am very happy that public health is being involved in those conversations, because we take care of the entire county, and the city of Colorado Springs has the largest population, and any opportunity to collaborate with law enforcement and first responders in different sectors, I think is very beneficial to the residents of Colorado Springs and the county. Also wanted to re-mention that General Jack Briggs and I also are serving on the Colorado Springs Mental Health Initiative, and we'll provide some updates as we go along. And my role on there, certainly I speak up a lot, but what my request is that we ground ourselves in data. And oftentimes there's a lot that is said on the news or in various different settings, and all of that information is extremely important anecdotally and to take the pulse and different perceptions. But we do bring data to the table, and whether it's the data that we have or whether it's the coroner's office report and making sure that we're looking through a data lens as we're having input on what priorities we believe should be taken up and enhanced with the city of Colorado Springs. So did want to mention that, and that's an evolving discussion. There has been nothing that has been decided. These are just a few weeks in, but did want to mention that I am encouraged that public health is being brought to the table and having a voice within these discussions and an opportunity to provide data. Now for the next topic, you've probably all heard a lot about West Nile virus lately, and if you were here back in 2003, that's when it was an emerging disease, and that was a very busy year. We are going to provide an update from Dr. Albanese and our Environmental Health Division Director, Rory, on the status of West Nile virus in El Paso County and kind of what that outlook is, and we still need to practice prevention. I mean, there's some opportunities there.
Hello, we're going to tag team here at the moment. So again, Dr. Albanese, I'm a co-medical director at the agency. I'm Roy.
Yeah, Roy Kroger, the Environmental Health Division Director.
All right, so in case you thought West Nile virus became boring, it hasn't this season. So we have a little result, unexpected, unwanted, shall we say, result of our spring, wet winter and very, very wet spring, which has led to a lot of pooling of water all over the state. And when you have pooled water come the beginning of the summer and into July, it is a breeding ground for mosquitoes. And when you have a breeding ground for mosquitoes, you run the risk of mosquito-borne disease. And West Nile virus is probably the most common mosquito-borne disease that we have. It's regional a little bit in the United States, but certainly in our area. So we have had a variety of headlines and alerts from the State Health Department and from us in El Paso County about, at least early on, right, about the fact that we are going to have a heavy mosquito season. We anticipated a heavy mosquito season, therefore runs the risk of West Nile virus, and in fact that has come true. Next slide, please. Okay, so I'm going to focus actually on that graphic to the right so you can understand about what West Nile is. So West Nile is a mosquito-borne disease. So the mosquito picks the virus up from infected birds, and that's actually the normal cycle. Birds get infected, mosquitoes feed on the birds, they get infected, then it goes to more birds, more mosquitoes, more birds, more mosquitoes. So that's what Mother Nature wants, and that's how the virus remains around from season to season. But then what happens with that mosquito is sometimes it's like, well, I just picked up this virus from a blood meal from the bird, and now I'm flying around and, oh, look, there's a person. And I'm carrying the virus, and I didn't have a blood meal on the person, and then I sort of basically inject the virus into that person, and then there you have an exposure. Sometimes that can also happen in horses, which is the other sort of species that we might see. So these are spillover infections. They're accidental, incidental. They're not part of the normal nature of spread and maintaining West Nile virus in the environment. So what happens is you get an infected mosquito, picked it up from the bird, and then feeds on a human, and then we end up with human disease. So in El Paso County, our first human case of West Nile virus was reported on August 1st, but things have changed a lot since then, not only in our county, but across the state. So because it takes time for enough birds to get infected and then enough mosquitoes to feed on the infected birds, like you need, so you need some conditions. You need a bunch of mosquitoes, and then you need some infected birds, and then you need more mosquitoes feeding on the birds, and around and around. So it takes time in sort of the beginning of the warm weather season with pooled water to sort of get enough concentration of infected mosquitoes that we end up seeing human cases. So the human cases typically will come to our attention in public health when they're diagnosed, sometimes in late August into September, but we've had a busy season. Next slide, please. I'll show you that data in a moment. So what are the symptoms of West Nile virus infection in people, and who is at risk? So the one good thing, I guess, if there's something good about West Nile virus infection, is it's actually most people who get, the blood meal and get the virus kind of injected in their body and get infected actually don't have symptoms. So about 4 out of 5 are like, I don't know what happened. And so that's a good thing. However, that's not the only thing, because that leaves about 20% where something can go sideways. So in about 1 in 5 people who have been infected with the virus, you'll have a flu-like illness. So fever, body aches, headache, and then there can be a rash. Okay, and sometimes it's the rash with the flu-like symptoms. Let's set COVID aside. Flu-like symptoms in the middle of the summer, minus pandemic. You'd be like, oh, what's that? But then when you get the rash, then you start thinking about West Nile virus, and that can happen within about 2 weeks after being infected by a mosquito bite. However, and say, okay, well that's unfortunate, and those people generally will recover. However, in about fewer than 100 infected people, so less than 1%, it can actually spread beyond just those systemic illnesses and actually infect either the brain itself or the fluid around the spinal cord and the brain. So the brain itself is caused encephalitis. It's a brain infection, a brain viral infection, or it can be meningitis. All right, and so that's the serious form of West Nile virus disease. Those are the individuals that will need to come to medical attention because you can have fever, so symptoms of meningitis, fever, really bad headache. You can have seizures, and the brain infection can progress, to have partial paralysis. So these are serious illnesses coming to medical attention. And so, in fact, that's how we diagnose West Nile virus often enough, right, is someone who's hospitalized with an unusual symptoms of brain infection or meningitis, and then they do West Nile testing because it's the middle of the summer, and then we discover these cases. So who's at risk for getting that severe neurologic infection? People 60 years of age and older, people with diabetes, chronic kidney disease, weak immune system. So these are the individuals that we want to be especially attentive to for prevention, because if you have those risk conditions and then you get infected with West Nile virus, you may end up with this severe outcome. Next slide, please.
So good morning. So how do we know that there's West Nile virus in the mosquitoes that are in our county? A lot of that comes from monitoring, and we have different agencies across the Front Range and all over Colorado and the nation, for that matter, that do some sort of monitoring to detect what we have out there in the community. And so since everybody's doing a little bit of something different, it's important to pay attention to what our community is telling us. So here at El Paso County, one of the ways that we really try and monitor the virus is what is our community telling us? Are we getting complaints on mosquitoes? And definitely those numbers are up this year. We are receiving many more complaints than normal in environmental health. And then we also have community members that may be doing additional work. Fort Carson has a really active program, and I stay in touch with them and hear from them every week. The city of Fountain actually has a program down there where they're not only doing some testing or trapping for mosquitoes and testing, but they're also doing some abatement programs down there. And so it varies a little bit from community to community. We're also talking to our neighbors to the north and south. Douglas County is doing much the similar type of programs that we are doing here in El Paso County. But Pueblo has a more active program down there where they're actually contracted out with a private company to do testing for mosquitoes, trapping of mosquitoes, and then also abatement. Most of the abatement that our people are doing are related to trying to kill the baby mosquitoes before they come out of the water and fly around and bite people. And that seems to be a more cost-effective way of dealing with that part of it.
Thanks, Roy. Next slide, please. So let's look at some data. So this is data from CDPHE, the State Health Department, about people reported with West Nile virus infection so far year to date. So let me orient you to the graph for starters. So on the bottom, the horizontal x-axis is what we call the calendar weeks of the year that we use in public health, and I superimposed the months of the year so you sort of know where we're at. The orange line is our current cases that meet our case definition in public health, so typically symptoms and a reliable positive West Nile test. And then the blue bars are the historical average of number of cases reported during those calendar weeks over the 5-year average. And so one thing that sort of stands out is that orange line graph, and that bump up until where we are in August is A, high, and B, way preceding our normal average time frame, right? So in previous years, the highest number of cases that we would have reported that meet public health criteria for reporting would be, late August into September. Well, basically from the middle and end of July into this first half or so month of August, not only is this when we are getting reports so early, we've also already, the peak has already exceeded any highest week in the 5-year average, the previous 5-year average. And so don't get fooled by the decline in that orange line because we haven't experienced that part of the month yet. So that the shape of that graph is going to change. And so we are having an early and intense season with West Nile virus infections in people. Along the top, you can see that there are, again, a significant number of cases that have neurologic symptoms. Again, we are more likely to pick up West Nile virus infection in the most severely ill because that's when testing would occur. So it's a little bit biased towards that, but it is telling us that people are suffering those neurologic outcomes. Okay, next slide, please. So this is data. This was we updated this yesterday. Data on the human counts of reported West Nile virus infection cases per county. And so you can see El Paso County on there as 7. That's a lot of cases for us compared to historical, which is usually 0 or 1 or 2 cases in an entire season. Okay, so we have infected mosquitoes in our county, and those infected mosquitoes have been biting people and people that are coming to medical attention to get tested. The counties that typically show us a lot of cases are Larimer County, Weld County, so there's nothing, I mean, their counts are up as well, but there's nothing unusual about in the north central section of the state. So Boulder, Larimer, Weld, those are areas that typically do see a lot of cases every season, but everybody is busy with detecting cases this year. Next slide, please. So, as I mentioned earlier, so this is just, so on the left side of that map is just the historical, the pattern historically in Colorado on where the most human cases are detected and reported. And as I mentioned, that darker blue and Larimer, Weld, both Boulder area is where that map looks similar every year. But I would say this year that the end of this season map is going to look different than this map because of the manner in which we've had so much precipitation and standing water in the state. On the right side of this slide are the summer 2023 mosquito West Nile virus testing results. So as Roy had mentioned, the decision for a county or municipality to test is up to them and typically tied with what we plan to look for the mosquitoes that carry West Nile virus, which are called Culex with a C mosquitoes, and then test them for West Nile. And this typically tied to mitigation activities like spraying and dunking, which we'll describe in a moment. So again, a lot of testing being done in those counties historically that would expect to have a lot of West Nile cases, but basically a lot of this testing is done at the CDPHE lab, and in a report that they released last week, every county in the state that has a mosquito surveillance program, someone within it, where testing is done at CDPHE lab, has detected West Nile virus in their mosquitoes. So that is unusual. We don't usually get through a season. Some counties skirt by, and you're like, well, we're trapping some mosquitoes, and we see some Culex mosquitoes here and there, and we tested them West Nile, and it's negative. This year, whatever county has submitted, mosquitoes has already been positive. So that is early and unusual to see that this time of the year. And that little table, sorry, that comes up a little small on the TV screen, but that table on the right just demonstrates the counties that have already been finding positives. And as Roy mentioned, Fort Carson have reported to us that they have actually multiple pools of mosquitoes that they tested, multiple samples of mosquitoes that they tested that are positive for Culex and positive for West Nile virus. So it's here in El Paso County. Next slide, please. So I just wanted to share, normally talking about El Paso County West Nile cases wouldn't be so much of a story because we would just have very, very few in a given season. That's not how it is so far. So this is data from our communicable disease team. Yesterday, we've had 12 cases identified and reported in the county. Again, 10 of those cases have neurologic symptoms, so 8 have the brain infection itself, which is really the most serious form of West Nile. You have to have viral infection inside your brain. 2 have the meningitis, and then others presented with other types of illness. And when we're able to interview the cases and we try to figure out whether their exposure occurred here in the county, for the 7 that we were able to interact with to ask that question, 6 said, yeah, I'm just here. I'm just here. And the map on the right, so those is identifying where we have detected the cases. And I'm not trying to do this to sort of pinpoint where someone's house is. I'm showing you this data because the whole county, when we originally got reports, the media would ask us, tell me exactly the location of where that person's lives. So that's the only place that there's West Nile virus. No, it's all over the county. The message to the public is infected mosquitoes are probably all over the county. And the fact that we start getting human cases already answers the question, do you have Culex mosquitoes in the county? Yes. Are they infected with West Nile virus? Yes, because that's the only way people get infected. So anyway, and then Roy finish up with
So the next slide, please. So what can you do to protect yourself? I think the most important thing to remember with West Nile virus is this is not something that somebody else is going to protect you from. This is something that you need to be active in preventing yourself. So there's some simple steps that a community member can take to really protect themselves from West Nile virus. We used to say a lot, follow the 5 Ds. Dress for being outdoors. Protect yourself mostly at dusk and dawn because the Culex mosquito that is mostly responsible for spreading this disease is only I won't say only out, but mostly active at dusk and dawn. That's the time they prefer to be out flying around. That's the time they're going to bite you. So if you're protecting yourself at dusk and dawn, you're really improving your odds that you're not going to get this disease. You also want to drain standing water. If you've got a cap full of water, just a little bottle cap full of water, you can breed hundreds of mosquitoes in that over time. And so it's really important to drain any standing water. And that's where a lot of our complaints come from in environmental health is people will call and say that there's standing water in a pond or there's standing water in their neighbor's yard and they're not doing anything about it. And so we really want to emphasize drain the standing water, even on your plants. If you have standing water in the bottom of your plant, drain that. If you have tires in your yard, make sure that there's not water standing in those. Anything that holds water and it gets warm is going to provide a chance for mosquitoes to breed. The longer it's there, the longer that chance is that those mosquitoes are going to be Culex, and those are the ones that are going to be spreading the disease. So also make sure you protect your houses. A lot of times if you have openings through window screens and doors, then those mosquitoes will get in your house, and then you have to protect yourself around the clock from those. So please cover up those holes that you may have. And then I've also got some little donuts here I'm going to pass around to board members. And just make everybody aware that these are a great little tool that the public can buy from any home improvement store in the community. They're relatively inexpensive, and they really help kill those baby mosquitoes before they get out and fly around. Donuts that I'm passing around, basically you put them in standing water and they actually kill the mosquito larvae before they become adults. And that way that mosquito doesn't come out and start flying around and biting people. One of those donuts, as we call them, can treat 100 square feet of water. So if you have a pond that's 10 foot by 10 foot, one of those can effectively treat that entire pond. And so it's really important to, if you can't drain your standing water, to be able to treat it. And if you have a swimming pool in your backyard, a lot of times that's where people can breed mosquitoes. You take care of that pool properly and you don't have an issue. But if you're not taking care of your swimming pool and you're letting it turn green, then the odds are that you're also growing mosquitoes in your backyard swimming pool. So there's lots of opportunities for the public to protect themselves, and that's what we're really concentrating on here at El Paso County. Is our communications team has done a lot of effort to get information out to the public on how you can treat for mosquitoes and protect yourselves from this disease. So that's really important. If we can go to the last slide, please. Oh, one other thing I want to mention also, if you can't cover up your skin, then there's opportunities to use DEET or those other approved EPA repellents so that you don't have those mosquitoes landing on you and biting you. So that was the fifth D in the series was DEET. So it's important for everybody to remain vigilant, to protect themselves, and to know what their risks are. If you're out running or bicycling in the evening, then take extra precaution, cover up a little bit, and wear that DEET where you need to. And know that we are trying to monitor this, and we're going to continue our education efforts so that the public knows how to best treat them, or how to best treat themselves so that they protect themselves from these mosquitoes. So they are actually a non-toxic. It's a bacteria that is actually in those things, and the bacteria gets into the gut of the mosquito and kills the mosquito, but it doesn't kill any other insects or living organisms. It's completely safe. Thank you.
Dr. Albanese, will you give us an update after the season supposedly ends, so we can kind of see really what
See what
the
that orange
is?
line does?
Yes.
Yeah. I'd be happy to.
Thank you.
Actually, thank you for reminding that, and I'm sure Haley's probably forgot this. So we've actually had 2 deaths from West Nile virus in El Paso County. And then there's been a death, I think, in Larimer, Boulder, and the third, Weld. Yeah, so we had one, both of those were neurologic infections in older adults. So that's how severe this can be. You know, you take West Nile virus in persons with underlying risk factors, particularly older persons, and then you infect their brain or their spinal fluid, you're going to have a problem, right? Like, things are going to go sideways.
I would just go ahead and confirm Mayor Glant's comment that it was a reported death in Pueblo also. There is.
Yeah. So,
and you know, as Dr. Albanese had mentioned too, this is unusual, and you know, it's evolving. So the best thing that we can do is prevention, and we do work with, you know, different municipalities in the community and such. And this is something that is not new in the sense of it's been with us since 2003, and there's a lot of knowledge on prevention efforts. It's critically important at this point in time that we practice those and be aware, because Dr. Albanese, what I'm gathering from what you're saying is that we've got a while to go, and so this is not going to be a couple of weeks. This is going to be how long?
I mean, we'll be tracking cases until October, typically when things wind down, but that's the word typical. We're not in a typical season. I mean, we've had a bizarre monsoon, maybe not monsoon, depending, so that geographically around the state has been a little different this year, it seems. But I think we're still left over from what happened in June and July in terms of mosquito breeding. It enhances itself, right? Like once that cycle gets going and you have a lot of infected mosquitoes and infected birds, it's just going to keep going until all of it settles down. So we tend to get most of our cases into September, so we'll see what that graph looks
Thank you. Can can I ask two questions, please? One, the first question, Dr. Albanese, you might have mentioned it already, but can West Nile virus can it be transmitted from bird to human or human to human? And second question is, would we have any prediction for the influenza season this year based on data from the southern hemisphere? And what is the recommendation for influenza vaccine, please?
Yeah, thank you. So, by the way, so the West Nile virus is not spread from bird to humans unless there's a mosquito involved. And once a person is infected, you can't spread it to another person. So it's very different than a lot of the other diseases we've been talking about for a long time. Prediction for the flu season, I have none other than a vaccine will be here. Christy, probably, yeah, for us in public health, but the manufacturers of flu vaccine have been making the product since February, March, which is when they get the strains that were going to be included. So that product will start coming out. It'll probably come out sort of in the private commercial market before we get all of our doses here in public health. And then, of course, the updated COVID vaccine will be available probably sometime in September as well. So we'll come back and review those recommendations. They're going to say the same thing now. Just get the vaccines to do what you can to protect yourself in advance of these respiratory seasons started. But Dr. Vu, we'll see. We'll see. Did you read something that concerned you?
I did not read it, but I was told that based on data, southern hemisphere, the influenza season was quote unquote bad. Probably not severe, transmissible.
Yeah, it's so we're still not normal out of the pandemic yet, and so we're having a COVID surge that's not necessarily breaking news headlines this summer, but comparatively, we have more COVID cases now, partly from the new, yet another variant, another strain making its way around, and then, of course, in part because everybody's trying to do things normal again, and so we just have a lot of people-to-people interaction, a lot of people flying planes, all that, flying on planes and all that kind of stuff. So, so we'll see with this respiratory season. Again, for us in public health, the message is going to be a prevention. We have something available. We will have something available soon, in about a month, to protect yourself in advance of exposure, travel, vacations, holidays, and so forth. And so that message is going to stay the same, and hopefully people, make a good decision.
That concludes my report. If there's any other questions?
Okay, then with that, I will entertain a motion to adjourn. Okay, thank you, Mayor Plant. And second from Councilman Donaldson. All in favor of adjournment, say aye.
Aye.
Aye. Thank you.
Well,
I guess my mosquito farm that I have in